Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Today we're joined by Dr. Pamela Smith, who's one of the LDN Research Trust's medical advisors, and thank you very much for joining us today.
Happy to be here.
So can you share with our listeners what's been happening with LDN in your practice this year?
Well, the newest thing, because we have been using LDN in most of our patients long-term for at least 10 years, but now we have discovered that people are much more toxic than we thought. We always knew there was an issue with toxic metals, lead, mercury, cadmium, things of that nature. We always knew there was a problem with microplastics and BPA, endocrine disruptors, of course, forever chemicals, which are pesticides. The trouble was, until recently, we could not remove those toxins effectively. So honestly, I quit measuring BPAs because I could only get rid of 5% of them by a sauna. I did not have another method. We have now in our practice at MD Lifespan literally done over 500 patients with therapeutic plasma exchange. TPE is becoming very, very popular, but our research shows the following. TPE itself, by itself, does not work to remove toxins. You have to add other things to it. So those things that you add are, for some people, stem cells, exosomes, for everyone, IV nutrients, and for everyone, low-dose naltrexone. It is paramount. We are now able to get rid of BPAs 92 to 100% in every patient. The same with phthalates. We're able to remove toxic metals that we could not get rid of before, like gadolinium and aluminum. We can get rid of different kinds of other toxins as well, like pesticides that are really forever chemicals, and even mold. We've been very successful with therapeutic plasma exchange plus nutrients plus LDN to decrease that inflammatory component that now we can successfully remove mold as well. This is groundbreaking, Linda. It is going to change medicine for the next 15 to 20 years because most people are toxic, and now we have a way to get rid of it, to get rid of that inflammation, to allow the body to heal, and to allow the immune system to normalize. We had so many people who have autoimmune diseases now. When I was in medical school, there was only 24 autoimmune diseases. There's now 108. And we have always used LDN for autoimmune diseases for more than 10 years, every autoimmune disease, all of them, all 108. But now added to TPE, it's a very effective therapy, whether you're talking long haul COVID, whether you're talking about chronic Lyme, Hashimoto's, Crohn's disease, it doesn't matter. Even polycystic ovarian disease is now an autoimmune disease. Very, very helpful to give that patient low-dose naltrexone.
If you're treating a patient with mold or environmental toxins, how long would they expect it to take to feel better?
That's a really great question. In the past, we have, or if you have minor mold, you can certainly use binders like clay, charcoal, even the prescription cholestyramine. Doesn't taste very good, but you can use it to remove minor amounts of mold. We are discovering if you have a lot of molds, like I do, I have a lot of mold, then in order to do that, TPE plus low dose naltrexone. It does take about 5 sessions a month apart in order for it to get it out of not just the tissue, because it will get out of the bloodstream the first 1, 2, or 3 sessions, but it does take 5 to also get out of the tissue and the bloodstream and be eliminated from the body.
That seems to me to be very fast compared with, I know some people that have had treatments in the past and it's been ongoing for years. Not
Absolutely.
5 months.
Some of the patients that we've seen have not felt well for 20 years. And now, in about 6 months, it is life changing for them.
So, can you explain these therapies for people that haven't heard of them before?
Yes, therapeutic plasma exchange has been around for more than 50 years. I started out as an emergency medicine physician in a level 1 trauma center in Detroit, Michigan. And before we had Narcan, otherwise known as low dose naltrexone in baby doses, before we had LDN, we did TPE. We did therapeutic plasma exchange to get rid of the toxins. And then that went by the wayside. And when Narcan came on the scene, but what TPE is we take out the plasma and we put back in albumin. So the toxins leave with the plasma. What people don't realize is that everything else leaves too, because we're taking out the plasma, the person's medicine they took that day, that leaves. The patient's vitamins they took that day, that leaves. So what we do at MD Lifespan is that we literally put the IV in after the TPE to give back the nutrients to the patient so they're not nutritionally deplete. And then, of course, we started the patient on LDN beforehand, and then we continue it long term. As you know, Linda, for most patients, because they're inflamed, they stay on low dose naltrexone lifelong.
Yeah, definitely. So, what was the other therapy that you were saying?
So that's the TPE therapeutic
Yep.
plasma exchange.
Mm-hmm. And we don't have IV nutrients here in England. I think there might be some private clinics that do it, but on our NHS, which is our national health system, we don't have IV nutrients. So in England, if you couldn't afford to go privately and pay a fortune, is there any way round of having those nutrients without having them as an IV therapy?
No, and in all honesty, in the United States where I practice, it's not paid for by insurance either. Our
Oh,
healthcare system does not pay for TPE for this purpose. It does not pay for IV nutrients for any purpose.
mm-hmm.
Unfortunately, the healthcare system in most countries and what they're willing to pay for lags behind, unfortunately, the true science that is what we can now prove.
Mm-hmm.
And we have published one article already on TPE using nutrients and the removal of toxins. And we have 4 others that we are about to publish as well.
Oh, wow, that's amazing. Maybe that will bring change.
We hope.
So, is the therapy expensive?
It is unfortunately expensive. At least in our personal practice, we have gotten the costs down. Each exchange, depending on whether we add stem cells or exosomes or something, because someone may have had a heart attack already. We want to decrease the plaquing in the vessels of the heart. We want to prevent memory loss. The other reasons we do it. If you add other treatment modalities, then yes, it will be more expensive. The basic TPE with nutrients runs between 6 and 7,000 American dollars per treatment. It was 10,000. So we have worked with different people to get it down. So we got it down about 30 to 40%. Still expensive, but that is certainly an improvement over what we started with 3.5, almost 4 years ago.
Mm-hmm. And times that by 5, that's wow, a lot of money.
It is expensive, but it's really fascinating, Linda. As you know, and I'm sure you see with all the wonderful practitioners you work with, the many patients who are truly sick, when they come to us, they have tried everything. They have already spent $100,000 before they met us. It's amazing because they've been sick for 10 or 20 years. And, maybe hormones helped a little bit. Fixing the gut helped a little bit. Giving neurotransmitters may have helped a little. But the big change, and all of this, is to get rid of inflammation because inflammation is the cause of all chronic disease. And when you add together looking at TPE and low dose naltrexone and even hormones, because what people don't realize is that in both men and women, hormones are anti-inflammatory. It is all about inflammation. But again, TPE by itself does not work. You need the nutrients, you need low dose naltrexone to take that edge off to allow the immune system to come back and be healthy.
So, what has been the success rate with your patients that have finished the therapy? Have they remained stable?
That's such an interesting question. All of them have. So right now it's 100%. We do avoidance therapy. So we teach people not to do things like this, drink out of plastic. So I brought this as a prop here today. Okay. So we teach them not to do that, to have air filters and use water filters. So avoidance is very, very important. That's a key thing that anybody can do. That's listening today, even if you're not ever going to have TPE, is at least look at low dose naltrexone and avoidance. And so we honestly, so far, have not had to repeat the therapy. Once people were done with 3, 5, 8, whatever sessions it took, we've never done more than 8 in a patient, and that's very rare. We haven't had to redo them. We've actually retested and retested and retested every year for 4 years. We've not had to redo anybody as long as they were willing to avoid whatever the toxin may be.
Mhm. How would you know if a patient had mold or you suspected a patient had mold?
Well,
What
there's
are the
different
symptoms?
yeah, there's different kinds of um, testing. Certainly, there's a shorter test which looks at 5 molds, okay, done by real time. They will do a shorter test. Vibrant Health does a total toxin test, which looks at many molds and looks at a total of 109 toxins.
Wow.
And it is very, very surprising to us how toxic some people are. We have a new person who came to us yesterday, and starting in 2017, she had her house sprayed for pesticides, and the company that did it told her she could go in right away. Well, since 2017, she hasn't felt very good. And now she is to the point where she's having so much fatigue. She's having trouble walking. She's having trouble with brain fog. She's really becoming almost to the point of being less functional. And so far, she added it up. She had spent $185,000 in trying to get better with all of this. Had she started on LDN? No. So this is new for her. And when we did her toxin test, it's the worst we have ever seen, ever, anywhere in the world. She is by far the worst. We can see that we know what's going to happen. And for her, it may take 8 sessions because she's so toxic. She has a whole page full of toxins in the red, meaning really, really bad, and a whole page full of people in the yellow, meaning way too high than it should be, but not crazy high, but certainly more than borderline. She has pages full of these toxins. So we can see why she has brain fog, why she has intense fatigue. And she's only 50 years of age. That's very young.
Mm. Wow, that's amazing. So when a patient comes to see you, how do you work out whether it is heavy metals or mold, or do you just know from experience?
Well, it's a little bit of both. This is my 48th year of practice, so in some ways, I know a little bit by just listening to what their symptoms are. But as a scientist, we always test. And if I honestly think it's just mold, then I may do the smaller test. But starting in about 2017, there were people we couldn't get better. It didn't matter what we did, they couldn't get better. And we would give them LDN to take off that real inflammatory component. They would improve, but a whole host of people still, they were 50% worse than they were when they were young. And so we're discovering that almost all of that now is related to toxins. They're just everywhere in the world. It doesn't matter if we're talking in the US, England, or Dubai, or Brazil. If you do a test in any of those places, people are just now plain toxic. And so it's that inflammation that it's causing. But I want to be clear to everybody, TPE by itself does not work. You have to have the nutrients to go with it. You have to have the low dose naltrexone to make it a successful therapy. We actually prove that, and we're going to publish that.
Is it a set list of nutrients for each patient, or is it individualized per patient?
It depends on what people come in with. Some people, we do a very personalized approach, depending on what the toxins are and what their symptoms are. And we also can measure nutrients and mitochondrial function and all those other things as well. We do have 10 patented protocols that we use in our practice. And so we do look at the idea of what happens with the heart. So we have cardiac, we have autoimmune, we have brain health, we have different protocols. So we talk through that with the patient. So some people select, hi, I just want everything designed for me. And some people say, no, you know what? I'm only here because I have Parkinson's disease. And I really want that autoimmune disease treated. And what can we do to help that?
Mhm. Oh, you've been doing an amazing job. I mean, your success rate, I interviewed one doctor and he said that can't possibly be true. Because I think he'd listened to one of the radio shows that I'd done with you. And I said that the whole thing is with you. You don't give up till you get there. You know,
We don't.
you're not happy to say this patient's got 90% better. You stick with that patient till you've got a higher success rate, nearly to the 100 or 100%. You don't quit.
We really don't because the science is evolving. I mean, if we had talked 20 years ago, TPN was basically only kept for autoimmune diseases only. And if we had talked 20 years ago, LDN was very rarely used for the purpose we use now. And over time, the science has evolved that we have discovered a little bit of inflammation heals, too much causes, honestly, every single disease that there is. And so we have to get that inflammatory component down.
Well, that's fantastic. And we've got 2 minutes left. What would you like to say to our listeners?
When people ask about low dose naltrexone, do I personally take it? I do. I take 1 milligram of low dose naltrexone, and I actually learned that from an oncologist speaking at the LDN conference. And he really convinced me that 1 milligram helps prevent breast cancer. I have breast cancer on both sides of my family. So for 8 years now, I've been taking 1 milligram of low dose naltrexone every day of my life. There is a new caveat to that, though, that we are discovering. Some people do get tolerance when they take it long term. And so now we do recommend that people do not take it 3 days out of the month so they don't build up a tolerance. So, what I usually do myself and suggest to my patients is that you don't take it the first, second, and third of the month, just easy to remember. And then you take it the rest of the days. And then we have not discovered any tolerance whatsoever. If people are going to take it for years and years, they take 3 days off a month as what we lovingly now call an LDN holiday.
Wonderful. Well, I ought to give that a go because I've been taking it 23 years nearly. So perhaps I need a break. Well, thank you very much. This was Dr. Pamela Smith who's joined us today, and we thank you.
My pleasure, truly. Thank you so much.
Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.